Hi everyone! Today we're going to talk about neonate assessment, which is when an infant is born, medical professionals assess their health, and they do it in a couple of different ways. So the first one we're going to talk about is the Apgar scale. So it's called the Apgar scale because it was developed by a person named Apgar, as well as there's an acronym that's also used in Apgar. So I'll show you that in just a second. So the Apgar scale is administered right at birth, and it's administered at the first minute when a baby's born, and then again at either 3 or 5 minutes, and then also at 10 minutes. So it's really important to get that assessment right away after baby's born. And so it measures these 5 signs of health, and this is where that acronym comes in. Appearance, pulse, grimace, activity level, and respiratory effort. And these 5 things sort of act as a proxy for other serious health problems that may be present at birth. And so these 5 signs are all scored for a total score from anywhere from 0 to 10. So if the score is 7 or above, the baby's not in danger at all. But if the score is 4 or below, baby's in critical condition and needs immediate attention. So this is the table from your textbook that kind of shows how all of those 5 signs are rated. And they can be rated at 0, 1, or 2 points. So if they look at appearance, they look to see what the baby's coloring is like, and they look at the bottoms of their feet, inside their mouth, or their palms of their hands. And that way they can get a good assessment to see what kind of blood flow is happening, which they also do using a pulse or a heart rate. And then they look at grimace, so they see reflex irritability, if the baby's crying or making kind of a face of some sort. You don't want baby to be looking too calm upon birth. And then they look at activity level, so are baby's arms and legs moving around? Are they resisting extension? Are they kind of crunched up in like the fetal position? And then another really important one is the respiratory effort. How are they breathing? Are they breathing shallow? Are they breathing regular breaths? So these are how the 5 points of the Apgar scale are assessed. So next, let's talk about different characteristics of neonates. And for this, we're going to talk about reflexes. So reflexes are defined as simple, unlearned responses to stimuli. And they're markers of typical brain and nervous system activity. So we know that if babies respond in a reflex manner, we know that everything is normal then with their brain activity and their central nervous system. And most newborn reflexes disappear within 4 to 6 months. So let's talk about some of those reflexes now and what they mean. So first is the rooting reflex, and this is when touching the baby's cheek sort of initiates a sucking reflex. And this is present right at birth. And so this sort of has an evolutionarily adaptive purpose, because when baby's cheek is touched by mother's breast, then it knows that it's time for feeding. And so this is something that has been adaptive for survival in infants. As you'll see with a lot of the rest of these reflexes, that you'll see that they're sort of adaptive for survival. So the next one is the Moro reflex. And the Moro reflex is actually really interesting. So if you're holding a baby securely, and the position is suddenly changed, so as if you were holding it upright and then all of a sudden quickly goes downward and the baby's head kind of moves in that downward motion, baby's back arches and the legs and arms will fling outward and toward the chest. So they throw their arms out and they're looking to grasp onto something. And you can clearly see why that is an adaptive reflex, because if baby was being dropped by a caregiver, then they would want to grasp onto something to survive. So I actually saw doctors do these reflex checks just to make sure that baby's developing normally. And I saw a few friends of mine who demonstrate this with their newborn infant, much to the horror of some nearby friends. But it's perfectly safe and it's perfectly okay. So we also have the grasping reflex or the palmar reflex. And that is when if you put your finger in between a baby's forefingers, they'll grab onto objects. So they won't use their thumbs when they're doing this, but they will use their forefingers. So this is another adaptive strategy to make sure that that baby is secure and not being dropped. Okay, so the next one is stepping. So if you hold a newborn or a young infant up, their legs will go in the motion of walking. So they'll put one foot in front of the other, and they'll probably have their toes in the ground, maybe their flat foot on the ground a little bit. It looks as if they're attempting to walk. They don't have the motor development yet to walk. They don't have the coordination yet to walk. They don't have the muscle tone yet to walk. But you can see that babies are sort of programmed to be able to do that walking motion. So their body is ready. There's something in their body that is ready, and it knows that eventually that's what's going to happen. And after that is the Babinski reflex. So that is another one that has to do with kind of grasping or holding on. That's sort of the adaptive purpose of this. That is if you stroke the bottom of baby's foot, then the toes will spread out in a fan motion and then curl inward. So think about if baby needed to hold on to something in survival mode long time ago, in before ancient times, prehistoric times. Humans have evolved to have this sort of adaptive survival strategy. So that's where this toe grasping sort of motion comes from. And then finally, the last one is the tonic neck reflex. And so this one's another sort of a motor development reflex like the walking one. And people don't really think that it has much of an adaptive purpose. At least I've never heard of an adaptive purpose associated with the tonic neck. So when baby's lying on the back, it might be initiated by touching the lower back, or it might be just self-initiated. But they'll turn their head and their arm to one side, sort of coincided turn and arm extension. And people think that that has to do with purposeful grasping. So even though baby doesn't have the motor coordination or the muscle tone or the cognitive ability to make a coordinated grasping effort, it's sort of like their body is ready for it when it's going to happen later. Okay, so those are the ways that we assess neonates, and that's all I've got for you.